Afternoon to everyone, and as always, thanks to those who are tuning in. I know that people are practicing social distancing, so there were lots of folks who couldn't come today, including all the reporters, not to mention everybody at home who tunes in every day. For today's 2:30 update, we're coming to you live from McCormick Place in Chicago, where the Illinois National Guard, the Army Corps of Engineers, and a host of tradespeople are setting up the largest of our alternate care facilities to support our response to COVID-19. I'm here with the City of Chicago's Mayor, Lori Lightfoot, with Deputy Chief of Engineers and Deputy Commanding General of the U.S. Army Corps of Engineers, Major General Robert F. Whittle, and Dr. Nick Turkle, former President and CEO of Advocate Aurora Health, and now the Executive Director of the McCormick Place alternate care site. Folks, I want to share with you just how important this day is for Chicago and for the state of Illinois. 5 short days ago, this was an empty convention hall. There was truly nothing here. Throughout this week, I have tracked the progress of this build-out, and I want you to know that I'm genuinely blown away by what's happened here. We've all been through a range of emotions together these past several weeks as we've battled COVID-19, but when I walked into this building and saw how it was transformed in just 5 days, I was truly flooded with an overwhelming sense of pride and patriotism. The teams on the ground here have brought everything to the table for Illinois. In less than a week's time, they've assembled 500 rooms and beds, 14 nursing stations, and full support rooms for supply storage, pharmacy needs, and housekeeping. In 1 week's time, the heroes who came together to make this possible built us a facility larger than the largest hospital in Illinois. 1 week, and they will be building out to 3,000 beds before the end of the month. This, folks, this is Illinois. I'm not sure I can fully express the extent of my gratitude to the many individuals who made this happen. I want to thank the Army Corps of Engineers, the Illinois National Guard, FEMA, and the hardworking union tradespeople. And I'm going to list all of them because they all deserve recognition. Electricians and plumbers, carpenters and pipe fitters, teamsters, telecommunications, laborers, operating engineers, decorators, sheet metal workers, iron workers, and finishers. Monumental, round-the-clock dedication is what got this done before we need it, preparing for saving lives in the event that things become as bad as some have predicted. Really, to all of you who are tuning in today from across the state, you should be so very, very proud of what's happened here, and they're continuing their work. We've also launched work on 3 other sites in Chicago and the Collar counties: the former Advocate Sherman Hospital campus in Elgin, the Metro South Health Center in Blue Island, and Westlake Hospital in Cook County's Melrose Park. And today, I am proud to share with you our next site, Vibra Hospital in Springfield, Illinois, which will begin to add more beds to our capacity in central Illinois. I want to take a moment to walk you through the why behind these facilities. As incredible as the work that's been done here is, it's also profoundly sobering. This is a facility that we stood up because the human population is susceptible to this virus at a scale never before seen in our lifetimes. And it very well might be that this virus overwhelms our existing hospital capacity in Illinois, as it has done in Italy and other countries around the world, and as it's beginning to do in other parts of our country too. In places like New York and Boston and Detroit and New Orleans, we're already seeing this very real scenario take place. As a point of reference, on March 24th, we here in Illinois had about 26,000 non-ICU beds, 2,600 ICU beds across the state. Every day since, we've added beds and equipment at our existing hospitals to increase capacity. Even with those efforts, of our now nearly 28,000 beds in the state, only 11,500, or 41%, are currently available. That's a lot fewer than is normal for this time of year. Even more striking, of the approximately 2,680 ICU beds in this state, just slightly over 800 are available. That's just 29%. And that availability is diminishing as COVID-19's presence continues to grow. Since yesterday's update, Illinois added 1,209 cases. COVID-19's reach now stretches to 64 of our 102 counties. In the last 24 hours, 53 Illinoisans lost their lives fighting COVID-19, bringing the total number of Illinoisans who have passed away because of this virus to 210. That's 210 fathers and mothers, brothers and sisters, grandparents and children who are no longer with us. May their memories be for a blessing. They are the impetus for us as we prepare this facility at McCormick and the other alternate care facilities around the state, because I never want to get to a place where our families or our friends don't have a place to heal, or where our hospitals don't have the capacity to give them the best chance possible to beat COVID-19. Preparing also means proactively assembling the healthcare workers who will bring these facilities to life. A hospital bed is just a bed until it has the staff and equipment to turn it into a place to treat COVID-19. We've already assembled the medical personnel who will staff these first 500 beds. Nearly 140 healthcare heroes from around Illinois and the nation are ready to work here, and we'll be adding many hundreds more as the need evolves. Before I turn it over to Mayor Lightfoot, I want to address one final topic. Over the last few days, we've seen information start to trickle out from the White House and the CDC about whether or not the general public should be wearing masks. So let me go ahead and tell you where I see the science trending. Epidemiologists and infectious disease experts are still studying how COVID-19 travels through the air between people, and particularly how it travels from people who are asymptomatic or pre-symptomatic. That research is still evolving, and it'll continue to evolve. Nevertheless, here's what I think, and it's based on what the experts seem to be saying. There's a reason that we're raised to cover your mouth or use your elbow when you cough or sneeze. It's a simple gesture to reduce the number of germs that you spread to those around you. The doctors all agree that this virus can be spread through droplets, like when you sneeze or cough. So blocking that by wearing a mask in public seems like a common sense way to do what's right for everyone around you. The most important thing you can do, frankly, is stay home. But when you do go outside, or when you must go to the grocery store or pharmacy, wearing something to cover your face is a good idea, based upon what the science says. Maybe it's a homemade fabric mask, or maybe it's a manufactured general medical mask, really just something to cover your nose and mouth out of courtesy to those around you in case you're one of those who are asymptomatic or pre-symptomatic and who could be spreading the virus. Wearing a mask is just one more way that we can help take care of one another in our state.